lecture or interactive teach for a small group. Fear of forgetting, fear of losing control. If you start taking small group discussions, one dominant group will take over the class. That is the main fear, and we will forget something. By preparing for the interactive sessions, we will lose some topics. That is the main drawback. So we have to cut down the information. We have to be concise, and we have to maintain time. Time is the main limiting factor. So always be willing to take rest and abandon your preparation if you face any problem. Be clear in your objective. What you want to tell that you can deliver. Remain, you have to be concise. So after learning all the interactive teaching methods, don't go and let the students with all the interactive methods. So start with one method at a time and slowly improve. So remain flexible. Do not overworry. So how to encourage participation? So Dr. Nalwar told, so the best group will get an incentive. So incentivize, appreciate by maintaining eye contact, and be unpredictable. Ask questions at the beginning, in the middle, or at the end, and don't expect correct answers. But students will list answers and they will involve in the discussion. In that way, they can learn. So, question is a surprise. Ask questions throughout the lecture and ask to raise hands. So, if a student asks a question, make another group to answer this question and make another group to support the answer. So, in that way, we can involve students. So, disadvantages, we need some support for implementing this. We need time and we should be trained in all these techniques. That is the main thing. And student participation. See, out of 175 students, only 7 participants. For the case scenarios, only 6 participants. And they are anonymous. They can write anything they want. It's the recent batch, last April. This response. They are completely anonymous, so they can write anything. It's slider, so they can write anything they want. And see, only this is from the last year Bcme session response. The same question, list of various people. The response only 19 participants respond. So even among the faculty, in that Bcme session also, the participation is very low. For the second question, it was 20 participants only responded out of 30. So this is now your responses, only 50 participants out of 30 responded. For the various teaching learning methods, 16 participants answered. So participation of the students is important. We can go with interactive teaching. Any teaching we will prepare, we will learn, and we will prepare for the interactive teaching. But main thing is students have to participate. So tell me, I forget, show me, I remember, involve me, I understand. This is the famous quote. This concludes teaching learning methods for large groups. Thank you.
Thank you, sir. That was a very enlightening session. The next session will be the same topic, teaching learning methods, the continuation of this topic by Dr. Nagashilata Madam, Professor of Microbiology.
your feedback for the lunch? You only said no. If it is good also, you can give your feedback. If it is neutral, then also you can give your feedback. But a constructive feedback is required. Which is good, which is bad, in what level it is bad, in what level it is good, how far it can be improved further. All these are required for better organization of the next Bcme programs. So in the teaching learning methods, with your experience as UG, postgraduate, what are the various methods that you have learned from your faculty? Where you have learned from your faculty? In undergraduate, postgraduate, or as assistant or associate. Learning is a continuous process. మీరు ఎక్కడ ఎవరిని చూసి ఎలా నేర్చుకున్నారు? ఓన్లీ ఇన్ ద క్లాస్ రూమ్ సిటీ, ఓన్లీ ఇన్ ద క్లాస్ రూమ్ సిటీ, గ్యాలరీ సిటీ. What you have learned only the subject, only the subject you have learned from your presenter, only subject. How to ask a name, how to participate. అది మాత్రమే నేర్చుకున్నారా? We have learned the communication skills, right? స్పెషల్గా ఒక క్లాస్ అందులో పెట్టి మీకు బ్రేకింగ్ బ్యాడ్ న్యూస్ అని నేర్పించారా? ఇంకా కమ్యూనికేషన్ స్కిల్స్, empathy towards patients, even attitude of our faculty. Punctuality, discipline, their style, their dressing. So many things we have learned from our faculty. So what are the learning methods that we have adopted at that time? All these were hidden curriculum. Hidden thing. What we are discussing was already in hidden one. What is your observation for this picture? For this image? Is it visible? No? Group discussion one. What is going on? What is going on? Mentally? Sir, ఇంతవరకు మేము ఇంకా మెంటల్ చెప్పలేదు కాబట్టి మేము మెంటల్ చెప్పలేదు. Audio-visual aids. What is going on? Teaching is going on or learning is going on? Both. Both. Teaching and learning is going on. So it is a combined way. That is, teaching and learning is a combined way for the students. So at the end of the session, previously Adinda Reddy sir was saying to list out your specific learning objectives for this session. So at the end of the session, I am expecting that the participants in Bcme in this session, they should understand the various methods used in small group teaching. At least they listed out the various small group teaching methods. At least few you have understood, it is good. At least some 2 to 3. And the principles of curriculum design. Why this curriculum has been designed? How it will be designed? What is the need of curriculum design will be discussed in this session. All this is overlapped one with Dr. Bani. So the challenge of our medical faculty is now is what to teach is not a problem with this curriculum. How to teach is important. Auscultating heart sounds we want to teach. That we know already. But how to teach the auscultation, how to they appreciate the heart sounds. This is important in this scenario. So in this curriculum-based medical education, health needs of society should be considered. What is required for the society? What the society is expecting from doctors? If we know that, if we know the needs of the society, based on the curriculum has been designed. Based on the curriculum, we try our Indian medical graduate to fulfill the society needs. So this all will be, after that, the student is expected that they have learned is by understanding, by doing their assessment. So previously, Navi was saying that, Dr. Navi was saying, questioning in between the classes. So there are certain methods that are to be practiced while you are questioning. Always, Satish, what you think about, or Shalini, what you are thinking about. Whenever you are asking the questions, ask the. You can raise the student. You can call the student by name. Then only it will be a good interactive session. So in between, we can also include assignments. Assignments is short assignments. What have like you can ask even reflections also, provide reflections also in large group settings. And problem-based learning, cognitive load theory receive a lot of attention. That is problem-based learning means what is the difference between case-based learning and problem-based learning? Case-based learning and problem-based learning. Suppose I give a case scenario to a phase 2 MBBS students that a 35-year-old female attended OPD with fever, chills and drivers with public micturition and urgency of urination. Then what is your provisional diagnosis? What are the investigations? That is case-based scenario. Suppose I asked my second phase MBBS students to attend nephrology OPD or the gynecology or whatever the case. First they see the case and they can come to their book or to the lecture to the mentor and what they are supposed to learn. That is problem is first they are assigned a problem. The students are assigned a problem, then we call it as problem-based learning. There are certain things that overlapping. Go through the picture. So these are already Dr. Ravi has talked about this problem-based learning. I am not concentrating this. But I can lecture all this. Have you attended any time panel discussion? Yes. What are your experiences with panel discussion? This will be a suitable method for our postgraduates rather than undergraduates. Panel discussion. Yes, what is your experience in panel discussions? Yes. So all of you have attended so many workshops, so many CMEs. You can share your views. And you said that lunch is also not good. Then you should not be sleeping. So panel discussion, a group of 4 or more persons, maximum of 8 persons, and under your moderator, the session will be going on and sits at the table in front of the audience and discuss, and this will be accessed the expert committee. And group discussion, So if now we are having 6 groups. So what a group should contain? What is the shape of the group? Is it rectangle, square, round? Which is preferred? Why? If it is of rectangle or square one, the corner one will be escaped, will not be visualized properly. So it is better to form a group in a round shape. And role play, now in CBME curriculum, each department has assigned certain active modules. So all these active modules, as per my knowledge, all this will be done by role plays. How the informed consent should be taken, how we should break the bad news, and what is the beneficence. All these will be by role plays. It is introduced in our curriculum. Simulation based. How many departments have introduced this simulation based learning to undergraduates? And it is our mindset that simulation means we should have a large setup and management should be there. Is it actually necessary? Or we can do it in a smaller scale also, with a low budget. I can share my experience in microbiology. In simulation based, we want our PhD students to learn how to collect persistent. So for this, can I require, is it mandatory to require a mannequin? Not so. So we have been prepared a dummy doll having the lesions looks like bone with Colgate paste and close-up paste and steroid swab is there, and they can do a practice that how they collect this assessment. Like that, how they collect the blood sample is also it is also a simulation based. So simulation based learning means the student can actively participate and they can learn how it will be.
Is there a classes structure in the group?
Yes.
So, one thing that we think as surgeons is that we need a very high-end image. I want to reiterate what I'm saying. So, when you want to demonstrate, say, taking a skin graft in a large book, is there a low-cost way to do it? Taking skin graft, what can you do? If you could have learned that. Any ideas on how to do SKS? Say there are 15 students. You cannot, and you want to teach them skin grafting, how to take skin graft. You cannot have big skin or simulated skin for so many students, right? If you got a very low cost ways to do it, just get them in motion. Can you think of something? Cardboard, not so great.
Living month. Living month.
Okay, regular class, what about cucumber? A cucumber, vegetable, a bottle board, cucumber. See, you're just trying to tell students how to do it basically. Some of my colleagues in Bcme show DNC, they use some of the vegetables. Melon, right? So that's what we're trying to tell you. Don't think simulation means some very high-end thing, only available in INIs. There are very basic ways. Those are the things we students should remember. That notion of how to use a Humvee's knife, how to use a Degas diameter, how to use basic things. So especially in psychomotor skills, these kind of low-cost simulations are very common. What Matt was describing is not just psychomotor, it's also cognitive. How to make these things and then how the entire process runs. So doing that psychomotor skill, we sort of re-increase those neurons that fire for cognitive. Why am I taking the first walk in a certain way? That is what the student will learn. So that becomes much more effective than talking about it. Much more effective than talking and also showing it. Doing what really helps. I think Dr. Vikman just said that last night. If I do, I'll learn. So that's it. Thank you.
Later surgery also, we can start with switching how they suture sponge and regular thread.
One regular thread, sheep intestine, fish, anything.
When you see the curriculum, volume 1, volume 2, volume 3, you are having BOAP sessions. What do you understand Bcme? Those who are with UGBT might have aware of this term. Bcme sessions. Demonstration, observation, assessment. Performing under supervision, and they can perform by themselves. For this, instead of reading this slide, I share how we can teach our postgraduates, especially if it is a bit, that is briefing and intraoperative teaching and debriefing. While they are reporting, I share my experience as a microbiologist. Our PG students are reporting regular bacteriology culture. Madam, today on mechanics medium, only 15 colonies were obtained from a urine sample of 35 years old. So that is of briefing. The student has told that they have identified a urine sample, usually more than 100 colonies will be considered significant. So what report can I give? So what you want to do next? That is of intraoperative briefing. So is the patient is on antimicrobials? Is the patient is on diuretics? And after inquiring all this, or what is the organism? Is it of Escherichia coli or it is of Staphylococcus aureus? Then after that, debriefing. So after inquiring all these, PG can again come back with these all details. Madam, the patient is on diuretics. The sample got only 10, that is of 10 to 20 colonies of Escherichia coli. What report can I give? That is, it should be considered as the patient is on diabetic, it should be considered significant bacteria. So this process, this method of teaching can be introduced in our PG curriculum. And if in intermediates also we can start with this type of teaching. As previously discussed, we are teaching our students. The students are learning from the facilitator not only the technical skills, but also what is the behavior. Are we coming 9 o'clock and going by 9:50 from our office? Or are we staying continuously in our OP? What is our style? How we are respecting to our professors? How we are respecting to our administrators? And what is the how we are communicating with our colleagues? All these will be continuously observed by our students. So be cautious as a facilitator. And mostly in the search group, Dr. Children's group of ACME, there was one ACME study, peer assisted learning and buddies learning. What is the difference between peer assisted and buddies learning? Buddies. Peer means same age group. We assign that so and so person should identify that he is his peer, and you can do both combined studies. What is buddies learning? Friends. So which will be better? It is buddies learning. So in a formal way, we can call it as peer assisted learning. Before this, what are the advantages of small group teaching? Advantages of small group teaching. Focused discussion. Content that has to be delivered can be delivered. More interaction. What are the drawbacks? So these 30 participants making out of 6 groups, how much effort the MU has taken? So for formation of small groups for 170 or 250 groups, 250 students, how much efforts that the department has to take? How many faculty should be engaged? What about the infrastructure? So all these will be categorized into strength, weakness, opportunities, and threats. And the threats always may group లో మీరు గమనించారు always ఒక్కరే సమాధానం చెప్తారు. ఈవెన్ ఎనీ గ్రూప్ స్టూడెంట్ గ్రూప్ అయినా మనం పెద్దవాళ్ళమైనా గ్రూప్ అంటే ఒకటి ఫామ్ చేస్తే ఓన్లీ ఒక్కరే డామినేటింగ్ పర్సన్ ఉంటారు. దట్ ఈస్ ద మెయిన్ థ్రెట్ ఆఫ్ స్మాల్ గ్రూప్ టీచింగ్. What can we analyze? What can be acquired by students in this small group. Analytical skills can be acquired better and organizational skills. No, work చేసుకోవటం, communication skills and participation of all the group members and collaborative skills can be acquired by our participants. So in this, these are the various methods of small group learning, small group teaching. What it is? Fishbowl technique. What is? Here we go. Read the picture. Read the picture. Inside one group and outer there is one group and the inner group is being observed by the outer group. So we can we are having 6 groups, group 1 and group 6, group 2 and group 5 and 3 and 4. Now group 1 will be in the center. Please stand up. Please stand up. All of you. All of you. All of you. Group 1 will be observed by group 6. Sir, you can come to here. Come to group 6, right? Group 6. Okay, go there, sir. Do one activity and you people will be observing this group. And group 5 group you sit and do one activity and 5 minutes. Group 2 come here. So you see, and the outer group will be observing. And make the same sir. All the inner group, please sit. Please sit. Group 1 should sit. Group 1 should sit. And group 6 should stand around them and observe what they are doing. So now it is observed. What has to be observed, what has to be done, it is not clearly defined. So now go through your curriculum book. Identify how many competencies in volume 1, one group, volume 2, another group, volume 3, another group. Choose any subject. On the table, you are having volume 1, volume 2 and volume 3. Group 1 can choose anatomy and group 2 can choose microbiology and group 3 can choose internal medicine. So when what has to be done is clearly defined, what has to be observed is clearly defined, this technique will be useful. Otherwise, మీరు వెళ్ళి చూడండి అని చెప్పాను అనుకోండి, ఏం చేయాలి ఏం చూడాలి అనేది పిల్లలకి తెలియదు, మనకు తెలియదు. So just for 3 minutes time. Before conducting this fishbowl technique, the student should assign one objective. The group has to be assigned with one objective. Then only this technique will be fulfilled. So what is your observation with this group? So please listen. Now group 6 is giving their observation on group 1.
They ate all the chocolates on the table.
So actually, what has to be done? Sumati has to be observed by one person, and Satish has to be observed by one person. Then your observation will be good outcome, having good outcome. And one has opened, and one has written. Sumati has written, and Dr. Satish has opened the book and searched for anatomy competencies. Like that, the observation when it is the design to see the curriculum competencies, how their work has been done. It is important. So Satish has seen this, and one should be the leader. No, everybody should be observed and everyone should participate.
we have observed that the persons were interacting among themselves and they were going through some books. That we have observed. That's handy.
Individual observation. So whatever the objective that is assigned, have you completed the objective? So all the five should observe all the five. Or you can assign one person should observe one. And one should be ideal. Suppose that's Shravan Kumar is sitting ideal without seeing any book or any writing anything. So that has to be observed. I'm sorry. It is not, so I'm giving an example, sir. It is not exact. Sir, open the book. Lovely object. Jigsaw method. Each group having 5 members. Yes. 1, 2, 3, 4, 5. Number yourself. Number yourself. Number yourself. 1, 2, 3, 4, 5. All ones, please raise your hand. All ones. Come to one category. All ones. All twos. All twos. All threes, all fours, all five, all fives. Group yourself. 1, 2, 3, 4, 5. So now group 1 occupy one table. Group 2 occupy one table. All ones, all twos, all threes, all fours, all fives. All ones. Group 3. So now your task is group 1 will discuss the various biometric methods that are adopted by MNC. Now your work is what are the various biometric methods that are adopted by MNC? Group 2. Group 2. What about the implementation of biometric methods in medical institutions? And group 3. Advantages of biometric methods that are by MNC. Disadvantages of biometric methods by MNC. And punishments for the biometric. The last group. Your time is 5 minutes. Group 1 biometric methods that have been implemented by MNC. Implementation of biometric methods in medical educational institutions. Group 3 advantages of biometric methods. Group 4 disadvantages of biometric methods. And group 5 punishments for so and so, etc. So now group 1 will discuss about the masters about the various biometric methods, and group 2 is masters about the various. Group 3 is about advantages of biometric. Yes. Now active and original presence. Now back to your regular things. Be fast. So now each group is master about all the components, right? So suppose my lecture is about tuberculosis. Just for the interesting sake, I am introducing this NMC biometry. But I won't think about any punishments. Nothing. Punishments you can categorize in the institution, department, faculty, like that, advantages, like so many disadvantages, so many advantages. This can be introduced in our regular teaching practice. Suppose I want to discuss about tuberculosis in two phase 2 MBBS students. So I categorize about the mycobacterium tuberculosis per se, pathogenesis of tuberculosis, clinical manifestations of tuberculosis. Like that, I can categorize the topic into some certain subtopics. Each topic will be assigned to one group. Then they can shuffle, they discuss tuberculosis. Now they discuss, suppose now the table 1 discuss about all the biometry implementation, like the group 1 discuss about entire thing about tuberculosis. This is the, we can introduce this Bcme method in large group setting also and even small group setting also. Any doubts in this switchboard technique and Bcme method? Flipped classroom. Are you aware of this? It is the easy one to implement in our regular practice. Flipped classroom. So we want to discuss about autoimmune disorders. Already hypersensitivity up to as per the curriculum, hypersensitivity is completed. Now the students are having the basic knowledge about immunity, immune response, everything. So now the students are provided with certain material, either the online class or the online material, online videos, or the handouts, printed handouts, or they may be instructed to read certain textbook also. So they come to the class with a knowledge of various mechanisms of autoimmunity. Now the session is having a lot of time to discuss about the autoimmune disorders and diagnosis of autoimmune disorders. Suppose if it is not so, what has to be done in class? What is autoimmunity? What are the mechanisms of autoimmunity? What are the classification of autoimmunity? What are the clinical presentations? How it can be diagnosed? What is the management? So all the learning objectives, some of the learning objectives can be done as a homework. This is about the flipped classroom, which can be introduced better way in our setting. So we want to, the tip of the Bloom taxonomy is to create. The student has to create from remembering to, we want to, our students to create the description or they are supposed to do. Here, why curriculum, how curriculum is designed. How now we choose the table make 3 volumes in volumes 9. ఒక సబ్జెక్ట్ లో మళ్ళీ 3.12 anatomy, then what is the competency, what is the method of teaching learning method, what is the domain that has to be integrated in this competency. ఒకసారి మీరు చూడండి ఏదో ఒక competency.
Center, not your material. Center lo 3 ఉన్నాయి volumes.
On your table.
Curriculum.
Not your personal
Not
material.
your research material.
Which is kept on your table.
Table.
Either volume 1, volume 2, volume 3, whatever the competency. So, how can we know that this topic has to be discussed in phase 1? This topic has to be discussed in phase 2. This topic has to be discussed in phase 3. And what topic has to be introduced in the Indian medical graduate curriculum? And how it has to be delivered, how it has to be assessed. Everything is in our curriculum. So for that, suppose we want to introduce a topic about organ donation, still it is not present in our curriculum. So what is the need of organ donation that the Indian medical graduate has to learn? Is there any need? or we want to introduce geriatric medicine, which is not present. So, what is the need of the topic? And it is must to know about this organ donation or the geriatric medicine, and for that, of the needs assessment, what are the goals and objectives of that? Our needs assessment is our Indian medical graduate should know about geriatric medicine. That is the need that the public is required, the society is required, that society is demanding that the doctors are not treating the geriatric population better. So we want to introduce a new branch in our curriculum. So for that, goals and objectives has to be designed. So geriatric medicine from physiology certain topics, and for pathology certain topics, and for general medicine certain topics. These are to be distributed across the phases. And education strategies, that is phase 1, how many topics? What are the geriatric changes, physiological geriatric changes that occur? That can be introduced in phase 1. What are the malignancies that they come across in geriatric age can be introduced in phase 2, like that. And how we interact with the geriatric population, phase 1, phase 2, and phase 3 in community medicine. So, in education strategies, in which stage it has to be introduced. So, now it is decided that in phase 1, physiology, about the geriatric changes that occur in this population has to be introduced. How many classes it has to be kept? 10 hours? 5 hours? So that has to be, all this will be the education strategies. What type of teaching learning method are we bringing our students to the fields in the family adoption program? 2 hours. In this geriatric medicine to the fields in the family adoption program, 2 hours. In this geriatric medicine, what is the education strategies that are to be implemented? And is 10 hours okay? Physiology, phase 1, physiology, geriatric medicine has been introduced. And is it successfully implemented? That will be the implementation. 10 hours. So now we are taking feedback from faculty and the medical educational unit, curriculum members, and from the students. Feedbacks will be given to the NMC. So they can assess how far it has been implemented. So based on the feedback, evaluation of all the things, and then it has to be implemented further in a better way. So now we are seeing the curriculum with so many volumes and so many competencies. It is not of single day work. It is so many experts in the subject and so many educational professionals have participated in this. How many of you have attended online courses? Online courses? As a mandatory basic course in biomedical research. As a mandatory. Any other? So for faculty development and student development also we can introduce online courses, and this edutech is, it is quite engaging and it is easy. మనం ఒకసారి రికార్డ్ చేసి పెట్టేసాం అనుకోండి, స్టూడెంట్ ఎప్పుడు కావాలంటే అప్పుడు వినొచ్చు, అండ్ ఇట్ షుడ్ మేక్ సర్టన్ ఫన్. Directly I go to this, all these are covered. And group 1 is one competency. Go write down your competency. Group 1, group 2, group 3, group 4, group 5 and 6. Take down your competency. Group 1, PR 17.1, enumerate and identify the cutaneous findings in vitamin A deficiency. Group 2, PE 25.1, discuss the etiopathogenesis, clinical presentation, management of malabsorption in children and causes including celiac disease. Group 3, define and classify headache and describing the presenting features, precipitating factors, aggravating and relieving factors of various kinds of headache. Group 4, yours is group 4. Group 4, describe the clinical features procedures, detection, effect of pregnancy on the disease and impact of disease on pregnancy, complications and management of pregnancy of urinary tract infections. Group 5, describe and discuss the idiopathogenesis, clinical features, assessment and principles of management. A patient with post-polio residual paralysis. Group 6, discuss and describe the etiologies of various kinds of pneumonia and their microbiology depending on the setting and immune status of the host. And for this competency, first write your specific learning objectives. For this, first write your specific learning objectives. Then, what type of teaching learning method is best to attain to fulfill this learning objective? This is your competency. For this competency, first define your specific learning objectives. Derive your specific learning objectives. For any topic, throughout these 3 days, any competency will be started with specific learning objectives. So please, all the groups should note down. And tomorrow also there will be my topic, and the same competencies will be given. Enumerate, identify the cutaneous findings in vitamin A deficiency. DR means it is dermatology, PE means pediatrics, internal medicine, OBG, ortho, and internal medicine again. First, derive your specific learning objectives. If you are clear about your specific learning objectives, then what type of teaching learning method can be adopted for that learning objective will be identified. All of you put on your book or on the flip chart. Better write in book. One has to present. We started with this time group 6. First, there are SLOs. Just by the side of SLO, put a column that teaching learning method, and again put another column which will be filled tomorrow. All the groups, please note down your competency. All of you first define your specific learning objectives. Is any group ready? Ready? It is not mandatory that the specific learning objective should be 2, 3 like that. How many learning objectives you can derive? It is fine. But should be specific. I think group 1 is ready. Any comments also accepted? Actually not satisfactory. So the competency is enumerate and identify the critical findings in vitamin A deficiency. What are the learning objectives? So at the end of the session, phase 3, part 2 MBBS students should able to 1. Enumerate, cut. Is enumerate cutaneous manifestations of vitamin A deficiency. 2. Should able to identify the cutaneous findings in vitamin A deficiency. In the first one, what is the students have been, what type of teaching learning method you want to give your topic? It is by didactic lecture, large group setting. Identify cutaneous findings. So it can be either bedside clinic, small group setting. It can be either bedside clinic, or by seeing certain videos or certain pictures, we can ask about. So your specific learning objective should be clear enough, so that the teaching learning method can be identified better. Yes. So for the first competency, what are the specific learning objectives? If along with this, we are discussing about vitamin A deficiency. Are we expecting that students are already know about the normal level of vitamin A? So it is already known that the students have crossed first MBBS biochemistry. So they are already having certain knowledge about vitamin A. What is the source of vitamin A? What is the normal level of vitamin A? All is known that we know that students have assumed that students are aware of vitamin A. Yes. Group 2. Discuss the etiopathogenesis, clinical presentation and management of malabsorption in children and its causes including celiac disease. Use mic.
At the end of the session, phase 3 part 2 MBBS students should be able to describe the idiopathogenesis of malabsorption syndrome in children.
Sir, all of you are almost writing so many protocols for your research papers. Objective is having only one word or two words. Again, we go to BCM. Objectives ఒక్క వాక్యం ఉంటుందా లేకుంటే 3-4 పెట్టేసుకుంటాం? Objectives ఒక ఆబ్జెక్టివ్ నెంబర్ 1, ఆబ్జెక్టివ్ నెంబర్ 1 word. So while you are discussing etiopathogenesis, etiopathogenesis is one specific learning objective. Then clinical presentation of celiac disease is one. Management of clinical presentation of malabsorption is one. And then management of malabsorption is one. So for this competency, how many syllabus you have derived? You told all 4 at a time, sir. So what the first learning objective? What is the teaching learning method?
At the end of the session, basically, also every students should be able to describe the video patterns of
Malabsorption.
Second one, at the end of the session,
Okay, at the end of session you say this form. Various clinical presentations of mole absorption.
clinical presentation of CDR.
Management of mole absorption is another part. So your first is what is your teaching learning method? What is your teaching learning method? You want your pathogenesis small group, sir? Clinical presentation? Bedside management, small group, and it causes including severe disease. It is also a small group interactive session. And group three, please give your feedback to other groups also.
By the end of the session, phase 3 part 2 students should able to know the define and classify headache and discuss the presenting features and specific factors.
Definition of defined headache is one. Then classification of headache is one. So for one competency, approximately for your competency, you can have around 6 to 7 learning objectives.
Definition of headache, one
Definition
SLO,
of headache correctly.
classification of headache, and presenting features and displaying factors for one SLO, and then aggravating and relieving factors of various kinds of headache.
Aggravating factors, one SLO. Relieving factors, another SLO. We can split your competency to the various learning objectives. Not of all together you can combine. So how many learning objectives you have derived? 6 competencies. So for the first competency, what is the teaching learning method? First learning objective, I'm sorry.
Small group discussion, definition
Small group.
and classification of headache also small group discussion.
In small group,
Small group discussion.
just a small group discussion. Actually, it is suitable for the flipped classroom. Flipped method. Students can be given previously that the definition and the classification, and now we can discuss in your class about the presenting features, displaying factors, the other thing. So even in the small group and the large group setting, what type of teaching learning method that you have been adopted is important. The other is
Bedside presentations. Bedside.
bedside clinic for headache.
Case presentations.
But it is not so headache at the bedside actually. The other one,
Small group discussion.
aggravating and relieving factors, we can put as a group discussion. The other fourth group 4, use mind.
Describe the clinical features,
introduction and effect of the pregnancy of the disease, and impact of the disease on pregnancy complications, and management of the pregnancy of urinary tract infection. 5 clinical features and detection and the effect of the pregnancy of effect of
First, tell the learning objectives, specific learning objectives.
urinary tract infection in pregnancy.
That is your session title
Learning objectives of clinical features
of
of urinary tract infections in pregnancy. 2. Detection of urinary tract infections
in
in
pregnancy.
pregnancy and the effect of the pregnancy on the disease and impact of the disease on the pregnancy.
Effect of pregnancy
On UTI.
on UTI.
And
Another one,
impact of the disease on the pregnancy.
that is fourth one.
And the management of the pregnancy. The management of the urinary tract infection in pregnancy.
So how many learning objectives that are
5.
derived from one competency?
5.
5. So how many hours it takes?
1 hour.
Altogether 1 hour. What is the teaching learning method?
Problem based teaching.
What are your audience?
Interns. Okay.
Interns ఖచ్చితంగా UTA తెలిసిందా?
5 years students.
Final students. No, while you are saying for all the participants, while you are saying your specific learning objectives, make sure that at the end of the session, which audience, that is phase 1, phase 2, or phase 3 part 1 or phase 3 part 2 students should able to do the things, that is should able to describe the clinical manifestations of urinary tract infections in pregnancy. So for that, what type of teaching learning method you are adopting? It is okay that large group setting. If it is small group, what type of small group method, teaching learning method that has been adopted for that to fulfill this learning objective? So in the second one,
5 years students. Case discussion. Case basic discussion.
yes, case-based learning.
At the end of the session, they are able to write the correct description of the management.
Directly you are going for the assessing students. First you are supposed to teach the students how to identify. So for that, the students should have been taught that what are the description of UTA, basic anatomy of UTA, and clinical manifestations of UTA in pregnancy, detection of that is asymptomatic bacteria in pregnancy, that is effect of pregnancy on the disease, it may lead to premature rupture of membranes, that is complications, and impact of the disease on pregnancy complications, management of UTA in pregnancy. So for each specific learning objective, one teaching learning method should be there. If you are having these specific learning objectives and teaching learning methods, then the way of assessment will be different. For one type of, suppose we taught to our students UTA as a didactic lecture. Now the students have been given a case scenario in their exam. Is it the matching one? The learning and assessment method is matching? No. So when the learning objectives are defined clearly and the suitable teaching learning method has been implemented, then the correct assessment will be done. Otherwise, it is difficult to assess. That is the motto of this Bcme. Not to make you sit for the 3 days, making you bored. And I feel sorry about. Till now, no group has fulfilled their specific learning objectives correctly. And this is the group 6. Group 5.
At the end of the session, the final year will be the
Students we are supposed to talk about the post-polio residual paralysis. We know, the topic we know. But how it has to be delivered to our students is different as for us. So the first learning objective, what teaching learning method you are adopting? Small group discussion. So your group are having diverse opinions. Small group discussion. So we want for neurogenesis, we want the didactic structure. Then assume the awareness, bedside clinic, and principles of management. Somewhat better. Yes. And only 9% are completing this task. Group 6. Group 6. At the end of your session, which group of students? Phase 2 individual students.
So, first objective will be various things of enumerate the possibilities of
Your first objective is?
various things.
Etiology of pneumonia. You want to know first learning objective. Second learning objective? Various types of pneumonia. Third. Third one. Their microbiology for what? Very microbiology. Their microbiology, the causative organisms and their microbiology aspects. First, in the first learning objective, etiological agents are discussed, and in second learning objective, the types of pneumonia are discussed, and in the third learning objective, microbiological aspects of the etiological agents. Then, correlation of the microbiological agents with the experiments. So, the first learning objective, what is your lesson? What is your teaching learning method? It is didactic lecture. Then, two, all three are all the four are didactic lectures. All the four are didactic lectures. Any objections from other groups? From pulmonary medicine?
Madam, give any homework to them. So that no.
Phase 2, they are attending clinics. Any comments from other groups? Are you satisfied with these SLO and TLMs that are described by group 6? So as it has not been satisfied by the organizing members, a homework has been given to you. Open your curriculum books. Open your curriculum books. Who are the majority? Phase 1, phase 2 or phase 3 faculty? Phase 3 partners are community medicine. So choose a competency from community medicine and internal medicine. 5 are there. Choose 5 competencies from community medicine and internal medicine. And group 2, phase 1 is there. Phase 1. Which phase? Community medicine, physiology, okay? Take a competency from anesthesia. So, general medicine. Take a competency from general medicine. All 5 take one competency. Yours, surgery, gynec, dental, plastic surgery, anesthesia. So choose competency from anesthesia, general surgery and gynocs, 5 competencies. And likewise choose your 5 competencies. One pulmonary medicine and so choose from internal medicine. Take one OBG, take general surgery, take anatomy anesthesia. Choose from your topic, from your subject. మీరండి మీరు గ్యాస్ట్రైకాలజీ మీ అండి చూసే కాంపిటెన్సీ ఫ్రమ్ ఏంటి ఆర్ట్ టేక్ కాంపిటెన్సీ ఫ్రమ్ దిస్ కరిక్యులం టేక్ అనస్థీషియా గ్యాస్ట్రైకాలజీ సో టేక్ ఫ్రమ్ So by 9:15 tomorrow, all of you should come with your specific learning objectives. No copying. No copying. ఒక్కొక్క కాంపిటెన్సీ తీసుకోండి. And group 6 is sir, your branch cardiology from general medicine. Take from ortho, general medicine, microbiology, from surgery. By 9:15 tomorrow. 9:15 tomorrow మీ homework మాకు ఇవ్వాలి. And if anybody wants to write more SLOs, more competencies, it is always welcome. So in brief, your small group, we can introduce the various methods to make more interactive in our large group settings, and the various methods that we can adopt easily in small group settings have been discussed so far, and this will be continued. This topic will be not small group teaching is ended by this session. It is not so. It will be continued and we will discuss it further and further in these days. Any doubts? Any doubts? Thank you very much.
All of you gather for tea and snack, and then we come back for the next session. Madam, snack, madam. Mali 10 minutes వచ్చేయండి. Madam, Madam, madam. అరే రాజు అలాగే అంటున్నారు. మేము ఈ 3 రోజులు ఏమో రావుతాము.
Hope all have gathered after the tea break. So now we are going to start the session by our young academic, Dr. G. Manoj Kumar Reddy, to deliver his lecture on Introduction to Assessment. Welcome you, sir.
Respected Dr. Sharma sir, observer from LFC Model Center, CMC Video. Respected NU coordinator, Dr. Sophia Madam. Respected faculty members of Medical Education Unit. Respected faculty members of Government Medical College, Kadapa. We continue our discussion. The day one of Bcme, post-lunch, post-tea break session. We continue discussing about assessment. So before going to the actual topic, I have a small activity. We will be handing over small slips to you. Try to answer the question and use your minds. And give the answer at least one person from each group. Not at all related to medical education.
What was the first thing you thought when you woke up today?
Sir?
What was the first thing you thought when you woke up today?
Anyone? Anyone from group one wants to answer the same question? Anita madam? Question apart from this course, madam. If you message to your sir in another room, what time you leave? Okay, madam. Next group.
Couch potato. Meaning of couch potato.
Yes, sir.
Somebody who rests, relax, and just sees TV.
You consider yourself, sir. I consider myself as most potato.
We are the same.
Go to house and find a penguin in your freezer.
What is the first thing you do after going home if you find a penguin inside your fridge?
First, I feel thrilled.
Okay, sir. Anyone from your group wants to answer the same question? No one wants to call the police? That is what I am doing now. Without knowing anything. Group 5. Question, sir.
How do you eat your way through a whole buffet without guilt?
Don't believe me, how will you complete all the items provided in the buffet?
I paid, obviously I won't feel it. So I
Okay, sir. Anyone wants to answer the same question? Dr. Karthik, you don't anything of me.
అదో పక్కగా ఉంటాను
That's what I expected. Next group 6.
The unwritten rules to be followed in an elevator.
Not reach elevator.
Probably.
Usually in elevator.
Not, especially in rings, sir. Not to get into the elevator, especially on second Saturday. Not pressing all the buttons at once.
Okay, this is just an engaging task. We'll continue our discussion. From morning we have studied what are the roles, goals, and what is the competencies. How to frame teaching learning methods for delivering competencies effectively. Now we learn how to assess the students. Moving to the first slide. please go through this slide. And each group can come with one answer about how this slide is related to the present day context of medical education. You can take 5 minutes of time. Before using the e-resources, please try to think in your mind. If you are not able to get the answer, you can use the e-resources. Please Google. Madam, you can think for 2 minutes and then use Google. This is something related to the medical education. Yes, anyone is ready? Anyone wants to answer? Group 2, Master sir. Yes, madam, Ashlesh, these are the given, how they are related to the present day context of medical education. Group 3. Group 4.
The last is avoiding the recurring problems and topics.
Either one is very hard.
Yes, madam, nice.
Either can survive any amount of load.
In any extreme environment. What about Mika?
Flashy, but doesn't have knowledge.
Okay, sir, now relate these three to our medical education. So, it is described in literature also, there are 3 types of teachers in medical education. Ostrich. So, ostrich does not want to survive or does not want to adapt to extreme environmental conditions or any change is happening in the environment. It just buries its head, digging a hole and thinks that nothing is happening around, but something is always going on. Because will accept that something is going along and tries to execute the same, but it is not completely adapted to the changing environment. So Viva is a man which is not working as code and it can survive in any extreme condition. So it will adapt itself to extreme weather changes and changes taking place around. It is also described in the literature, you can search in the Google also. So ostrich refers to individuals that ignore the principles of OBE outcome-based education, effectively burying their heads in sand and refusing to acknowledge that some change is happening surrounding the medical education. So because they are the medical teachers who superficially adapt themselves to the OBE, focusing on displaying learning outcomes without actually using them are incorporating them into the curriculum. So next will be the viewers. These represent individuals who can actually and actively implement OBE using defined learning outcomes to guide their curriculum designing, teaching methods, and assessment strategies. So Ashwin's approach is ineffective, Vikas' approach is superficial, Your approach is what is expected from the medical teachers after they complete this basic course in medical education. So now moving on to the objectives of this session. So at the end of the session, the learner should be able to Understand the role and place of assessment in new competency-based curriculum. The changes in assessment as per the new curriculum. Understanding the differences between traditional assessment system and competency-based assessment system. What are the components in competency-based assessment? What are the tools you can use in competency-based assessment? And importance of feedback in assessment. And helping in planning, developing and implementing the competency-based assessment in their departments, colleges and their universities. So this has been taught in earlier classes also. What is competency-based medical education? It is an outcome-based approach in designing, implementation, assessment and evaluation of medical education program using a set of competencies that are already designed by the NMC. So what is assessment? What is the meaning of assessment? Again, you can use your brains, but temporarily sharpen them. Meaning of assessment? You can use Google also. E-resources you can use. Meaning of assessment? Any one person? Yes, sir.
That's the competency of
So generally, what is the assessment? Meaning, sorry, sir, I think sorry.
Previously examination, now assessment.
Sir?
Previously examination. Assessment means.
No, sir, general meaning of assessment.
coming to something.
Actually, it is a Latin word. So, assessment, pushing aside and doing something that is called as assessment. Aside, which means to simply is something that you can do with the for the students and not to the students by sitting somewhere. It is a judgment of someone's ability which allows the assessor to make a decision about the current level of knowledge, skill or behavior of the learner. It is a pivotal element of CBME. It plays a crucial role in the implementation of CBME. It focuses on improving learning as an ongoing and longitudinal process that facilitators can identify the needs of the learner, they can plan the remedial measures and provide learning opportunities to improve the learning. So assessment in CBME, it is an integrated approach. So we can assess the knowledge by doing the examinations. We can assess the skills of the learner based on practical examination. We can assess aptitude and behavior. And all these three integrated is something called as a competence. So whenever the learner will exhibit all these three qualities, then we call him competent. So assessment in CBME, it takes a variety of different formats, and each sort of assessment can be deployed to investigate specific range of attributes, knowledge, skill, behavior, and professional attitudes. So instead of using singly, all these three can be combinedly used. The use of more than one type of assessment has the ability to give a multifaceted and more complete picture of an individual performance. It is much more different style of teaching, competency-based medical education, obligates a vastly different perspective on assessment. It mandates a greater emphasis on setting up an ongoing and longitudinal assessment so that teachers can identify the stage of the learner and decide whether they need further or different learning opportunities to acquire a competency. So here the role of the teachers is to help the learner acquire and improve upon the competencies. It moves away from time-bound assessment and looks competency as the endpoint. Here we are no longer interested in demonstration of discrete behaviors by the learners, but we are interested in application of these in each patient context. Thus, it is more about integration of knowledge with skills and attitudes rather than assessing any one of them in isolation. Therefore, assessment in Bcme should incorporate integration to the extent feasible while maintaining the subject identity. Already 10 to 15 slides are completed. We have another brainstorming session. So identify these two pictures and correlate them to the medical education. Take 2 to 3 minutes of time. These two can come with one answer at least. Everything it is described in the medical education literature. So we start with the last group now, group 6. Yes, sir. Group 6. Anything about, you can think about this picture in relation to medical education? Yes, sir. So we are all adult learners here. There is nothing wrong in telling whatever comes to mind. Group 5. Group 4.
Means without proper training. Second, training of
Okay, sir. Group 3. Third group. Group 2.
Experience based and evidence based.
Group 1.
Can they explain? Each person is explaining the character.
Yes, ma'am. So it is described like this. So here the medical student of a woman who is in labor pain. So similar to that of a woman who is struggling in labor pain, the medical student is struggling with all of his knowledge. So how does a traditional birth attendant or a dye will help the woman to get relieved of her labor pain? The medical teacher should also help the students in relieving his or her not labor pain, but we can call it as knowledge pain. So it is described like this. So our role it should be supporting to the students. So in CBA operates in the framework of competencies. Assessment tools should align with the competencies. to acquire competencies and their certification. It is a continuous and ongoing process with opportunities for providing feedback. Direct observation of students improves utility of CPA and feedback. Multiple assessors, multiple tools, and multiple assessments improve the validity and reliability of competency-based assessment. So, what is the purpose of assessment? Why do we need to assess? We can stop at the level of teaching learning methods, but we are moving to the assessment. Why we need to assess? So, it is a large degree determines what is learned to ensure our graduates are fit to practice and able to provide a high standard of clinical care and ensure that our learners are able to work effectively in our clinical context. Learners will significantly alter what they need to learn in response to the sort of assessment what they are faced with. So without assessment, we cannot motivate the learners to study. So assessment therefore can be used to motivate students to learn, to provide them with feedback about their performance, and additionally provide feedback for educators about the progress of their learners. Assessment can be of learning as well as for learning. So differences between traditional assessment, competency-based assessment, it comes from three important elements. Teaching and assessment have to be in the term of competencies. Discrete assessment of knowledge, skills and attitude is not required here. We should combine all of them. Third, there is a high context of specificity in competency-based assessment. So what can we assess in the learners? It requires a specification of measurable and observable entities. This would be in the form of whole tasks that contribute to one or more competencies or assessment of a competency. Another approach is breaking down the individual competencies into specific learning objectives related to knowledge, skills, attitudes, communication, and assessing them individually. There is an array of qualities you can assess: ability to learn, knowledge, skills, attitudes, and ability to work, to lead, and work in teams. However, not all knowledge, skills, and behaviors are considered equal. There is a hierarchy which is described by Benjamin Bloom. So this is called as Bloom's taxonomy. CPA is very useful to convey a message to the students to structure their learning around a competency framework. So Bloom's taxonomy was proposed by Benjamin S. Bloom. So it contains three important components: knowledge. We move from above down. So first the learner knows, understands, applies, analyzes, synthesis, judges. So this is called as a cognitive domain, knowledge, which is written or which is expressed in words. So the second domain is called as the skill, belongs to psychomotor domain, where the learner recognizes some acts, sequences acts, imitates, performs them, skillfully performs them, adjusts the performance, generates own performance. So this is a practical skill or psychomotor domain. So third one is called as the affective domain or behavior, where the learner is aware, responds, appreciates, rationalizes conflict, own personal ethic. So to put it in simple terms, if the learner is having knowledge about some medical condition, so he has acquired a cognitive domain. If the learner is able to do that practically, it comes under the psychomotor domain. And if the learner is able to interact with the patient or with the attenders of the patient, that comes under the affective domain. So who proposed this system of learning? Benjamin Bloom. So next, assessment of medical students is too much relying on theory work and it is mostly using knowledge. So he said this is not sufficient. So this model is known as Miller's pyramid. This was the basis for important move away from traditional medical education model, which was largely dominated by theoretical knowledge-based assessments towards examination on clinical practice. So this Miller proposed the Miller's pyramid. So here we move from down to up. Knows tested by written examination, knows how application of knowledge by theoretical problem solving questions, shows how by demonstration of the practical skills by RCP based presentation, does. So this is not we are bothered for the undergraduate students, daily patient care tested by work based assessment. So only does can skip. Remaining three are useful for undergraduates, knows how, and shows. So what is this pyramid called as? Miller's pyramid. So what are the attributes for a good assessment? So any tool will be having some attributes to say whether it is a good tool or a bad tool. So this was proposed by Wander. So based on 5 categories: validity, reliability, educational impact, feasibility, that is cost effectiveness, and accessibility. So if an assessment is scoring 5 points among these 5, then it is rated as a good assessment proposed by Wander. So what is validity? We all know degree to which inferences drawn from an assessment and supported by empirical evidence and theoretical rationale. A valid test is one that measures an attribute or performance that it is supposed to measure. So MCQs are a best way to test someone's theoretical knowledge. An essay question is also an effective method for testing someone's theoretical knowledge. So then what is the reliability? The reliable test will give the same results over and over again, any number of times it is performed. It refers to the degree of confidence that can be placed in the results. Depending on the context, it can be in terms of precision, consistency, or we can call reproducibility. So these are the principles of assessment proposed by Wander based on 5 factors: reliability, validity, cost effectiveness, acceptability, and feasibility. We will utilize the assessment tool. So now Bcme, it is a student-centered learning program. So this is what is the Miller's pyramid: knows how, shows how. This will skip. This is what we want to write. So again, another brainstorming session. So how is this picture related to medical education? You can take 2 minutes time. Please come with one answer with each group. We had a deep break and our brains must be functioning effectively. Last brainstorming session. After that, there are only few slides. We come from in between group 3. Third group. We come to the 1 point about this picture related to medical education or assessment. We are discussing about assessment. Yes, sir. Madam? Madam? Okay, group 4. Sir?
Roadblock.
Roadblock, cart block. Group 1. First group. Sir? Water, sir? Sir, group 1 has discussed for 5 minutes, one answer at least. Second group. Second group. Madam, Rajni madam. Assessment is colorful, madam. Examinations are not colorful, madam. Different for us as well as students. Okay, group 5. Over 6 group.
There is not quick service here, tell anything.
Okay, sir. Group 5. Okay. Somewhat closer. Many colors means many students are there here. So this is a flowering garden. So that was a flowering garden where the students are compared, or the learners are compared to the flowering plants, and the teachers are compared to the gardeners. They should understand the differences of the students in their classroom. Their goal is to help students grow and succeed. They differentiate instruction, monitor, and provide feedback for the students. So teaching and assessment, teaching, learning and assessment should align with each other. So this is called educational paradigm. The three domains, the objectives or outcomes for the session, the teaching method and the assessments all should align with each other. The purpose behind the teaching, its objectives or outcomes should relate to how it is taught and subsequently how it is assessed. So objectives, teaching learning methods and assessment all should be parallel and aligned. This is called educational paradigm. So next was the types of assessment proposed by Michael Schmidt. So he used two terms, formative assessment and summative assessment. So summative assessment, it is an assessment conducted at the end of the instruction of the term. It is to check how much the student has learned. Formative assessment is conducted during the period of study. The primary purpose is to provide feedback to the learners. So internal assessment, it is a range of assessments conducted by the teachers it can be both formative and summative. So the formative assessments should be a continuous program throughout the year. They should be conducted. The prime purpose of formative assessment is not to assess, is only to provide feedback. Based on the feedback received, we should alter our teaching learning methods, and then again the formative assessment should be conducted. At the end, the summative assessment. The main purpose of summative assessment is what the student has learned and whether promotion can be awarded or not for that particular learning. So this is something called as a formative assessment. Achievement, it also determines strengths and teaching learning methods is needed. Himself tastes the soup and orders the soup, that is called as the formative assessment. The retention of gained knowledge is improved when educational encounters are properly spaced and repeated over a defined period, and students are encouraged to apply ongoing learning, not a cramming skills just before the examination. So validity is a good requirement. Reliability can be flexible because we are not judging the students in formative assessment. We are only giving feedback. So different types of formative assessment. Again, we will be dealing with this in the tomorrow's next assessment session. So internal assessment is conducted throughout the professional year. It is to provide constructive feedback. So this is something called as the guidance concept of internal assessment. So in the first picture, the gardener is just checking the height and weight of the plant at the end of the season. Whereas in the second picture, the gardener is sitting with the plant throughout the session, identifying the needs of the plant, providing water, providing nutrients as and when required, and then assessing the plant at the end of the session. So this is called as the summative assessment. So this is called as the formative assessment. So compare the growth of the plant, and the learner can provide an important insight into the implementation of internal assessment. The gardener takes care of the needs of the plant, observing the leaves, branches, and color of the plant. The same way, the teacher can take care of the growing learner by observing many direct and indirect markers of growth. So this is a summative assessment at the end of the year. The main purpose is to judge the student whether he can or cannot be promoted. So validity and reliability are fully required for a summative assessment. These are the methods of summative assessment. So to conclude the session, in an identify all these important scientists we have studied before. Mixing at least one. Benjamin Blue. Miller. Steven, Michael Steven. Wander. So validity and reliability, Blue's taxonomy, Miller's limit. Steven. Steven. Formative and summative. Thank you all for your patience.
Thank you so much. Fantastic slide. So, this particular last question, I'm going to start backwards. You did an assessment of what you guys learned, right? These 4 pictures. So, my objective is at the end of this session, have you paid attention or not? If you answer these 4 questions, does that mean you paid attention? So, is my assessment valid? Is it valid? You must have paid attention, that's why the picture is there. Is it reliable? Reliable? Every time, next class also I put these pictures, will I be able to assess what you're doing? Yes, so it's reliable, it's valid. So those are very good. Is it flexible? Slightly, I can put new pictures, right? Is it fair? Everybody can see these pictures. All of us can recognize names. It's fair. It's fantastic. Is it relevant? Relevant? Does it matter who these people are? It matters. I don't know. Okay, it's a good question to think about. Because the reality is Miller said one very important thing. Assessment drives learning. What is not going to be asked in the exam? Will the student learn that? If you're not going to ask it, what do our students want to study? Math. That is what they want to study. There is no doubt about it. Why do they want to study that? Because that is all that matters. They remember their goal. Our goal is IMG. Their goal is not IMG. Our goal as medical educators is to make good doctors. Their goal is to become interventional cardiologists and serve the sick and dying poor people of rural America. Okay, that's what their goal is. Usually is. Right? So remember that since the assessment that matters to them right now is NEET, maybe next. That is what drives their learning. The second thing about assessments is that it's very important to your reliability, validity, etc. notes. So why should we focus so much on assessment? Why should we do it? Because you need to know what you are taught, what you have taught, is it working? If your students, after all the effort that you are putting in teaching, are consistently failing exams, you can really do this. One is that the exam is not correct, so the tool that you're using. Suppose I'm spending a lot of time teaching somebody how to do a fantastic lab poly. That is all I do. Every day he comes, he does 5 lab polies, every type of lab policy technique is done. He knows everything about the validity, blah blah blah. And the exam is ripples. It does not make sense, right? So something was wrong with the assessment, something was wrong with what my content was. So point number 1 was the assessment drives learning. Second thing is the assessment that you plan should be what you are teaching. So both are interrelated. Then going back to what I talked about, the tools that you use, no assessment tool is perfect. Okay? No single tool will ever tell you something. Which is what that Professor Van and their very difficult touch name figured out. And that's why he said there are 5 different things. It has to be reliable, it has to be valid, it has to be practical, it has to be acceptable. There is no point administering an exam to people in Tamil Nadu in Kannada. It is not acceptable. They don't know Kannada. How can they write the exam in Kannada? There is no point getting a FME candidate from Delhi and then giving him a fully Tamil patient and saying, okay, now you take long detailed history for BNB psychiatry for this patient. That's not fair. Right? So these are the things that we forget about in this country. Or that we were also got forgotten about. It didn't matter. We were told write this essay. Okay, we studied, what did we study? We studied guides, we studied important questions, because we knew that is what was going to be asked in the exam. I have a laundry list of Indian textbooks. I'm sorry if I made you. I remember during my post-semester, just writing out pages, because this is wrong. If I wrote it for my boards, I would just fail. So that is the problem that we are facing. So remember that now you all are going to make the papers. You all are going to decide first papers. You are going to do the formative assessments. You are going to do the summative assessments. And the principles that serve this is going to be went through are what are in there. Okay? So look at each question that you're asking. Remember, no single question will help. Try to form a set of rules. Try to fit it in 2 different ways. During your training, over the course of your 1 year, 1.5 years that you're training this particular student, what is happening to them? I love that garden example. That's how he's, how the student is growing. And finally, remember, we are the ones who setting papers in the university, nobody else. If we do a good job, we will get a good answer from these students. Thank you. Over to you, student.
I think most of the topic has been covered by the earlier speaker, so it may be repetition. So, what is an assessment? So, these are all the activities we undertake by the teachers and students. So, all the activities undertaken by the teachers and the students that will provide the information or results. The activities which gives the results or information. And another important thing is these results can be taken as a feedback. So this assessment includes the activities and results and which can be taken as a feedback. So what is the wrong with the present day, earlier day assessment? It was acted as a barrier rather than a bridge to educational opportunity. It was a barrier rather than a bridge to educational opportunity. And assessment has been labeled strength to put them in deadends. So you fail, once you fail him, you'll be like feel like he is a failed subject, and so you go on depression and it will be continued. So there is no recouping. And traditional tests have been soundly criticized as they are biased. Some students may be asked easy questions, some may be tough questions, and for some students the same question may be tough, and for the others it may be varied. And also the questions will be refinement. If the lecturer is interested in one topic, he will be asking the questions of the same topic. So the questions that student may not be interested, so that bias goes on continuing. And most important thing is neglecting of the referred students and repeaters. And assessment of results are already told, the language has been a barrier for some students. So this is it was a barrier rather than a bridge, and we are labeling them the failed students as the failed candidates, and biased questions, and neglecting of the backbenchers, referreds, and repeaters, language barrier. So these should overcome in the present assessment. So as already as discussed with the earlier speakers, the principles of assessment should be, it should be valid, and it should be reliable and acceptable to all formats, and it should be, there should not be any bias, and it should be equitable. To avoid all this, it is not efficient, it is not useful. So it should be valid for all purposes, it should be reliable, acceptable, equitable, and efficient. These are qualities gives assessment a good one. So there are three types of assessments: formative assessment, or summative assessment, and internal assessment, which may be overlapped in between them. So these are the types of assessment. Summative assessment is done at the end of the year after finishing the course. So it may, an interim assessment can be done at the end of the sem or at the end of the 3 to 4 weeks. And formative assessment is daily assessment. So what is the formative assessment? Is the one when results are actually used to the adapt the change your teaching. You conduct an assessment, you got a result, and you have to know what is the drawbacks in your teaching, and then you adapt modify your teaching, and so that students can understand what you are teaching. So this can be formative. When the results are actually used to change your method of teaching to meet the students' needs. So the formative assessment will come daily basis or during your lecture, or it can be taken as a feedback and improve your teaching and make them the students better learners. So what is the qualities? These are the qualities of formative assessments. It detects the specific strengths and weaknesses at the individual levels. So it is not in a group one, it will detect the specific strengths and weaknesses at the individual level. Frequency, the more frequency will be more, and it, during at the end of each unit or at the end of each session, at the end of each lecture. So it detects, and frequency will be more, area will be small units, small everyday lecture or a simple chapter or a single unit. And utilities, it is advisory only. So there is no pass or fail, so student is not afraid. So it is can be taken as a feedback. It detects the strengths, frequency is more, area is covered in a small units, so that they all can be put together, it will become a big one. And utility, you can take advisory. So no pass or fail. feedback, your students immediately identify the learning. Faculty will check its efficiency and identify its areas of weakness in teaching. So this is the difference. Whereas the formative assessment detects the strengths and weaknesses, summative assessment determines the overall achievement of a satisfactory level of competency. Here the frequency in formative assessment is more. Here only at the end of the year or at the end of the graduation, all giving promotion and area covered is entire course, not in small units or in formative assessment. Utilities, it is a permanent record. Feedback, you cannot, once it over, feedback is less important here. Students will only information pass or fail. Faculty will also have an impression of overall pass or fail. So what are the elements of formative assessment? For example, these are the main, some of the important elements that make the formative assessment a good one. So establishment of a classroom culture that encourages the interaction and rich conversation between the teacher and students. Allow them to speak, allow them to raise their hands and allow them to ask questions and their doubts. So establish a classroom culture that encourages interaction between the teacher and the students. So raise their hands and active involvement of the students in learning. Involve them in the methods of the learning and in the learning process. Not only allow them to raise their hands and also involve them in the learning. And establishment of specific learning goals and tracking of individual students' progress. So we should have a goals of individual students, especially the backlog students and backbench students and push students. And also they should be taught where they are actually need to be. So this is all can be done by creating a positive classroom culture. And take the feedback while you are teaching, while you are giving your lecture, get a feedback. This can be used as a way forward. Getting the feedback so that you can correct your teaching methods and put them their learning methods in track and take this big feedback which can be used as a way forward. And use of linear approach to assess the students' understanding. Everyday formats of assessment strategies, visual written tests and discussion, digital seminars and other things which can be assessed. And use of varied instruction method to make diverse. So students will have different categories and students will have different mindsets. So use all these teaching methods. Seminars and individual based learning, comprehensive learning, student-centered, and also classroom, individualized classrooms, and discussions. So these 6 elements will make the formative assessment a good one. So this is different between the formative assessment and summative assessments. Formative assessment helps students to learn and practice. Summative assessment assesses the student performance. When throughout the formative assessment is done throughout the course, and summative assessment will be done at the end of the course. So formative assessment is done throughout the course. And summative is at the end of the course. This is the final exam. And formative assessment will be useful in identifying the gaps and improve learning. Summative assessment will give a collective evidence. The formative approaches support scientific student needs. There is an exact learning products. Purpose of formative assessment. It provides a profile of what student has learned and it will provide a feedback to students to know improvement. Most importantly is it motivates the students who are backlogging and less interested students. And it helps students develop skills of self-assessment. And not only for the students, formative assessment will be helpful to the teacher. He will identify what is the lacuna in his teaching and it will be helpful in improving his teaching. So assessment improve learning, ranking of the student, measurement of improvement in learning, diagnose student, it will be helpful in diagnosing the student differences in learning and evaluate different methods of teaching and motivate students to study. So same, not only you are responsible, your students also feel responsible because of the CBME curriculum. They are involved in the learning. Increase student responsibility. He has to prepare all the logbooks and records regularly, and you have to write the regular skills. You have to show improved skills, develop more deeper understanding. So the formative assessment make the passive learner to active learner. This is one of the main advantages. This make the passive students to active learners and involve them in critical reflections and decision making. An effect of this formative assessment is students keep learning and remain confident that they can continue to learn at productive levels if they keep trying on. So, students, unlike in summative assessment, if they feel they go into frustration and hopelessness, here in formative assessment, students don't give up in frustration and hopelessness. Then what are the results? We all know about the advantages and what is most time consuming. It needs a lot of time. The teacher should spend a lot of time and we have to concentrate on each student, and so it is a tiresome. Moreover, it requires a trained and qualified personnel, and for funding limitation, results must be related to the implementation. Just taking a feedback is not enough. They should be corrected and implementation. So disadvantage time, tiredness and trained required qualified personnel, funding limitation and implementation problems. So how can you move approaches to formative assessment in be developed? So by investing in their own classroom practices, reflecting their classroom work, particularly the way question and give feedback. Each class is a different. So you collect what is the problem from your student and check them and reflect their classroom work and rectify it. Each student is a different, each class is a different, each subject is a different. So when you take the feedback and assess and then rectify. So this is the plan for the newer methods, and this is a cyclical process. Phase one, you clarify the expectations of the students, then elicit student responses and analyze them and interpret their responses, communicate with the students about their responses, then talking follow-up actions, adapting the corrective methods of teaching and learning. So this cycle goes on in a formative assessment until the student acquires the required skills. So what is the link between formative and summative assessment? Sometimes they overlap. Sometimes formative assessment need to include some reference to the summative assessment and vice versa. It is a cyclical process for successful students to construct for themselves. So there may be overlapping. So formative assessment includes this talking in a class, creating diagrams, homework, exit surveys. So this end year of assessments, midterms, end of the portions. So in between the formative and the summative assessment, we have another assessment, that is the internal assessment. These are the range of assessment conducted by the teachers of a particular subject with the express purpose of knowing what the student learned, how it is learned. It is curriculum oriented. eligibility of some now earlier because they taken eligibility to appear for final examination, now it is not there. That qualification is important. So this internal assessment can include assignments, preparation for a seminar, and clinical case presentation, preparation of clinical case discussion, and case study, participation in private work, and written test. Earlier we used to have only written test. Now we are having a group discussions among the students and ask them to prepare a seminar and ask them to give a PPT presentation. Now students are eagerly all doing this. This from my observation in the last 2 years, students are giving very good seminars and they are preparing very good PPT. Earlier they were not. So after implementation of these programs, they are actively involving in the learning process. So in the international assessment includes theory internal assessments. This can be OSP jobs. But by this objective structured clinical examination, avoid the bias. So same topics will be given to the students. Same we will have some 5 or 10 same questions. Ask them to write answers or you observe them what they are doing. So that the bias of varying questions, bias of varying cases has been removed as per the as possible by this asking methods. So internal assessment, there is periodic examinations. So as for the now, there will be no less than 3 internal assessment examination in pre-clinical para-clinical subject, no less than 2 examinations in each clinical subject in a professional year. When subjects are taught in more than one phase, the internal assessment should be done in each phase and must contribute proportional to the final assessment. So internal assessments also include day-to-day records and lab books, including the required skill certification. The final internal assessment should be, as per the unitary guidelines, it should be similar to the final all the constituent specialties. So learner must secure at least 50% marks of the total one. This is the earlier one. Now it has been reduced. Internal marks used to reflect separately in the passing marks. Now they are not there. Assessment of logbook should record all activities like seminars, symposia, quiz, and other activities assessed. It should be assessed regularly. The results of the internal loss should be displayed on the notice board within 1 to 2 weeks of the test, and then the student will know what is his likeness. And learners must have completed required certifiable complete. So, what are the ways and means to overcome the weaknesses of internal assessment? It should be broader and wider sampling involving all faculty of the department, concept of mode, and questions should be prepared from the all faculties. Some questions by some of the professors, some by some assistant professors, and it should be corrected individually. So there should be record keeping and sharing and discussing the results. Reliability is independent of objectivity. So including the questions, you increase the both validity and reliability of the assessment. So what is the analogy? So what is the difference between summative and formative assessment? This can tell the what is the difference. If the cook tastes the soap, that is a formative. When the cook tastes the soup, it is summative. Similarly, when your wife tastes the food, it is formative. When you taste the food, it is summative. Of course, you should have enough courage to describe your taste. Thank you.
Thank you, sir.
what we have given on material, no? In that one, we are having one feedback form. Day one feedback form. Please fill that day one feedback form and then give it to us. Fill up the post-test feedback form up to internal assessment and normal assessment before the workshop and after the workshop. And then another 5 pages says there is another one which is the report details form. You write in your words. And you can sign, you should sign over there, re-evaluation important. Two forms. ఇంకేం జరిగిందని మళ్ళీ మమ్మల్ని అడుగుతారని ఈరోజు పెట్టినా ఇక్కడ దాకా అందరూ రాస్తున్నారా లేదా
It is having second days also. If you can keep safely with you only, you can carry on with your booklets, with your kids. We will take tomorrow. Thank you all of you. We shall discuss today. Thank you for your patience.